go for a medical termination of pregnancy. For this, we were awarded recently by the IHW Council, that is the Indian Health and Wellness Council, and we received the award for patient centricity and advocacy for this Prega screen concept that we launched. Now moving on to another very important topic, cancer. So we all know today what a burden cancer is in this country, and how many of our esteemed oncologists and oncosurgeons are working very hard to control not only the detection, the treatment, the overall survival, the progression-free survival, and there is a lot of work happening around that. But what is very interesting again is that 5 to 10% of these cancers which are hereditary, or even if they are not hereditary, there are some biomarkers which are important for the testing. Now again, these sometimes, among them the most troublesome is the BRCA1 and the 2, which is the most penetrant cancer gene. And we know that 7% of breast cancers and 15% of ovarian cancers are just because of this mutation. And especially when you see women who develop cancer early, or in their whole family they have a lot of cancer, or there is a male breast cancer, or it's on both sides of the body, and various other markers are there by which we know that this patient could be a BRCA positive case. But again, BRCA is an expensive test and not available. How to make it available to everybody who needs it? And today, it's not only for detecting whether you could be having it, but also from a treatment point of view, because now there are drugs available, and especially for prostate cancers, which are castration resistant, and other cancers, and even in the treatment of breast and ovarian cancer, you have to know whether the patient is a BRCA positive or not. So again, when we looked at this data of ours of more than 500 individuals in which we had the hereditary breast and ovarian cancer or the ovarian cancer population, and this is what we see. And again, you will see that even look at your own data. Let us say Chennai, we are seeing a 16.7% positivity of this mutation. That is a very high incidence to detect and to pick up. And overall in the country, and as published by some more centers of excellence, I saw a couple of articles before coming over here, and I'm seeing everybody has published around 20 to 25% incidence, which is again a pretty high incidence to have. And if we are sitting on such an incidence, we need to do something about it.